Hi, everyone, and welcome to this latest session of Ask Dr. Sharon. I'm Sharon Walt, the Hashimoto Health Coach, and I'm delighted that you're joining me either live right now or if you're watching the replay. So the whole reason behind the Ask Dr. Sharon sessions is to answer any questions you might have about autoimmune conditions in general and Hashimoto's in particular. So where do I get a lot of my questions and topics? Well, most of them come from clients. Some come from my family. And also, excuse me, a lot come from just my general interest in keeping up with the topic. So what I want to talk about today is how to save your gallbladder. So why is that an issue? Well, problems with the gallbladder are extremely common. And cholecystectomy, so that's a surgical removal of the gallbladder. It's one of the most common surgeries in the Western world. And just in the States alone, about 300,000 surgeries every year. Now, the unfortunate thing is that surgery doesn't usually address the root cause, and more serious issues with the liver can develop. And as I talk through some of the interconnections during this chat, you'll see that. So let's get started here. First off, what does the gallbladder actually do? Okay, the gallbladder stores bile, okay, kind of like its name says. It's important to know gallbladder doesn't make bile. That's the job of your liver. So if you have problems with bile, and that's one of the major problems with formation of gallstones, the root cause is from the liver, and something you need to kind of be aware of here. Now, why is bile so important? Well, it's absolutely critical, necessary for the digestion and the absorption of fats, of dietary fats. So common gallbladder issues include, as I mentioned, gallstones that can cause a lot of pain when the bladder constricts to release the bile. Inflammation, in many cases that is due to the presence of gallstones, and something called biliary dyskinesia. So that's abnormal gallbladder motility. Now this takes into account things like really sluggish bile, so really concentrated bile, which is an issue from the liver. It could also mean a constriction in the bile duct, so that can be kind of a genetic thing. Or it can also be a problem with the nerve conduction around the gallbladder as well. Okay, so all of these can create problems, but I think the most common issue is with gallstones. So what are some of the warning signs? Well, first one is pain. So pain in the upper right abdomen can be often after meals, especially fatty meals. You may experience nausea or vomiting, and frequently tied to meals, the type of meal and when. You might experience some bloating or gas, and chronic bloating directly after eating is also a sign. Other things that don't seem directly related, but you can be experiencing too, can be dry skin, itchy feet or skin peels on the feet. So why would that happen? Well, if you're not digesting and absorbing fat, and fat is one of the things that are going to help with this, then that's where that's coming from. You could get a headache over the eyes. You may experience a bitter taste in the mouth, especially after meals. Your urine can be dark orange. Now, those are the kind of the symptoms that you may. Now, you won't necessarily experience all of them, but if you have experienced more than a couple, especially after eating, it's probably time to start paying attention. Now, some of the other signals of gallbladder dysfunction is part of your blood tests. So you can get liver function tests. These are not exotic tests at all. They are part of what used to be the yearly checkup. So these can include things like GTT, alkaline phosphatase, total cholesterol levels, ALT, bilirubin, triglycerides. As I said, all of these are very common tests, and you should be having them done every year and discussed with your GP. Now, let's just go on to what the causes of the gallbladder problems are. Well, as mentioned, gallstones. So gallstones are basically hardened deposits of bile that can include cholesterol and bilirubin, and these will cause blockages. This can also be caused by the gradual thickening of the bile. Again, as I mentioned, this is indicative of an upstream problem with the liver, which, if this is what's happening, you really have to pay close attention. Other problems, diet and lifestyle. Well, where have we heard that before? So things like a high-fat diet, obesity, rapid weight loss, and a sedentary lifestyle can also contribute to gallbladder problems. Hormonal imbalances. So estrogen, which can cause an increase in cholesterol in the bile, and this is one of the things that makes women more susceptible to some gallbladder issues. And there can also be a family history. So genetics can also increase the risk of problems. So one of the things that I really want to talk about and how to save your gallbladder is to look at some of the prevention tips. So let's deal with it before it gets to be a real problem. So the first thing is to eat a balanced diet. And I've talked about this heaps. So it's not just for other aspects of health, but it's going to save your gallbladder. Focus on whole foods, high fiber fruits and veggies. Avoid processed and fried foods. There's a lot of hidden fat. There can be also a lot of hidden sugar in there, which is going to exacerbate the problem. Focus on eating healthy fats. So these are things like the fats in avocados, nuts, extra virgin olive oil, good coconut oil. This is going to help keep the bile flowing and prevent the formation of stones. Maintaining a healthy weight. So, and this is important to avoid rapid weight loss. This can cause bile imbalances. Another point, stay hydrated. Drinking enough water aids in bile production and flow. It's also a major determinant in just keeping your liver healthy, which is going to make easier bile flow. Regular exercise. Physical activity is going to help you maintain a healthy digestion and prevents fat accumulation. Now, there are some nutritional supplements that can also help. So these include things like milk thistle, turmeric, dandelion. So all of these can support liver and gallbladder function. Omega-3 fatty acids, so these are the healthy fats, may also help reduce the risk of gallstones. And there is another supplement called D-limonene. It is an extract of citrus fruits, so especially from the peel, and it is a cholesterol solvent. And as I mentioned, the vast majority of gallstones are cholesterol stones, which occur from the oversaturation of cholesterol in the bile. So again, just going back to the diet, what are some specific foods that will help you support your gallbladder? Well, leafy greens, cruciferous vegetables, these help to detox the liver and support bile production. And if you have Hashimoto's, remember that your cruciferous vegetables do need to be cooked, even if they're not full, you don't want to cook them until they're soggy, but they do need to be heated in order to make inactive the goitrogens that are involved in it. Other things, beets or beetroot, they're rich in compounds that support liver health and bile flow. Turmeric, it's an anti-inflammatory and can also improve bile flow. Lemon water can stimulate bile production in the morning. And these are some pretty easy things to be able to supplement your diet with. Other things, fiber-rich foods, so whole grains, chia seeds, flax seeds, all help to get the digestive process moving. Now, let's say that you already have some symptoms. So what can you do? Well, number one, please do focus on your diet. So that is number one right there. But you should also consult your healthcare provider so that if early diagnosis, and quite frankly, this is before the need for surgery because surgery brings its own problems, you don't want to have serious complications. So things that they might look at is an ultrasound screening. They just want to check for gallstones or blockages. And again, just consider having a more holistic or functional medicine support. So addressing the root causes, poor digestion, liver congestion, hormone imbalance. Okay, but I would always start with looking at your diet first. Now, there's also some lifestyle factors that you need to take into account. So things like managing your stress, avoiding smoking or excessive alcohol. Both of these can harm the liver. And remember, there is a direct connection between the liver and the gallbladder function. And also consider liver support. Now, remember that I've said a number of times here that usually the upstream problem, if you have gallstones, is issues with the liver, and you don't want to mess around with that. The liver is so important. There's over 500 functions in the body that the liver supports directly. And if you're experiencing liver dysfunction, that is an actual severe health consequence. So, as I mentioned too, if you've already had your gallbladder removed, if you are one of the very many that have had your gallbladder removed, yes, there are still things that you need to do. You're removing the gallbladder. All that does is deal with the initial pain, and I get it. I don't think there are too many things that are as painful as having a gallstone. But just removing the bladder, your gallbladder, so that you don't have that gallstone pain anymore, can quite frequently ignore what the root cause is, and that could be issues with the liver. Now, other things that happened, you will need to be taking supplemental bile salts. So either bile salts or pancreatic digestive enzymes that also include bile salts. You need to be taking that with every meal. And that's because, remember I talked about the two factors that you need for digesting and absorbing health fats. It needs to be timed properly, and you need to have the right quantity or concentration of bile. If you've had your gallbladder removed, you no longer have the timing, you don't have the concentration of bile. You will still be secreting bile, but it's going to be dribbling out all the time, not when you need it the most and not in the right concentration, and that's when you are eating. Okay, so you need to take either the digestive enzymes with bile salts or bile salts by themselves at the beginning of each meal, and especially meals with fat in it. Now, also important, if you've had your gallbladder removed, you need to monitor your liver function. You need to get a yearly blood test and discuss the results with your healthcare provider. And if they're unwilling to do that, then find someone who will. That is one of the things that I do with my clients. Every time they get a blood test result, I will go through and I analyze it holistically. So I'm not just looking at, whether it falls in and out of a reference range. I'm looking at the impact of all of it. So there are a number of other functional medicine practitioners, health coaches that will also do that. It's really important. Do not let that go. I know from experience in my family, some of the tragic consequences of ignoring the upstream things from a liver for liver problems because you thought the problem was solved by just having your gallbladder removed. Okay. I didn't want to leave on kind of such a downer note here, but it is really important that just removing the gallbladder does not necessarily solve all the problems. Okay. Look, I hope you found this really useful. If you have some questions or some comments, please put them in the comment section below. If you have some other questions more to do with your personal health, you can always book a 20-minute session with me and we will talk about it. I've put the link to my booking thing in the in the comment section, and I'll also just put it up in the banner as well. Yes, there it is. Okay. So feel free to do that. I'd be happy to have a chat with you. Okay. Look, thank you for joining me today, and I wish you all the best for the rest of your week. So bye for now.